Hello and welcome back to the channel. My name is Dr. James Gill and you've joined me for another medical video. Today we're going to talk about one of those subjects that medical students should have a good understanding with, but also many patients come in complaining about, problems with the foot, specifically plantar fasciitis. So often patients will come to me and say, "Doctor, I think I've got plantar fasciitis," but what actually is that? And more importantly, will all the gadgets and potions and stretch bands and things that are available online and in the supermarkets and things actually help those patients? So let's have a look. Plantar fasciitis occurs when the thick band of connective tissue on the bottom of the foot becomes inflamed. In that sense, it's quite simple. Unfortunately, the mechanisms might not be so. This inflammation can cause pain in the heel and in the arch of the foot. I find patients often seem most troubled by the pain as it can sort of strike them off guard. It's particularly sore, after the first few steps in the morning or after they've been sitting for an extended period. Hence it becomes more of a problem for them because they think they've managed to cure it and things like that, but then it's always there at the worst points for them. So we know that plantar fasciitis is an issue with a connective tissue problem, but that doesn't really help us much more so far. The plantar fascia is this thick band of fibrous tissue running from the calcaneus, the heel bone, all the way up to the base of the toes, and it spans the entire length of the foot. Now, this is a vitally important structure for the foot. It acts to provide support for the arch of the foot. It acts to provide stability and shock absorbing. That shock absorbing is one of the reasons why when runners develop plantar fasciitis, they really do need to stop training, because without that, it's going to potentiate the existing problem, which could make things worse and potentially turn from micro tears into much more significant tears that may need an operation. But why does it hurt so much? Well, the plantar fascia is actually quite fascinating. When it comes to running and walking, the tissue will stretch, store energy, and then release it when it recoils back. And this is called the Windlass mechanism. Don't worry if you're not familiar with that. We will go through what a Windlass mechanism is in a bit. As a person walks, when the foot is in mid-stance, i.e. flat on the floor, the tension on the plantar fascia changes, meaning the foot can adapt to the terrain, distributing body weight and absorbing shock from any gait. Now, with regard to gait, when it comes to walking, the big toe, the great toe, is the most important of your 5 toes. So if you damage that great toe, which I've done, I've broken it in the past, that can have significant impact on your gait going forwards. In fact, the great toe is so important that there is a group of people in Africa known as the Doma in, I think it's North Zimbabwe. They're famed for what's called an inherited ectrodactyly. That's where they've got the absence of 1 or more digits. And with this group of people, they're specifically missing the 3 middle digits on each foot. So they've just got these 2 toes in a sort of a U shape. And in spite of just having these 2 toes, there is no impact on their mobility at all. Again, because they've got that great toe in order to be able to continue their normal gait and the normal biomechanics of the foot. So to double down, not only is the great toe the most important toe, but it might also be one of the keys to plantar fasciitis in some people. You only need to look at the size of the plantar fascia that's given specifically to the great toe. I mean, you can see it's almost double the size of any of the other pieces of tissue on the plantar here. As with all such differences in proportion in the body, particularly when we're talking about tendons and muscles, that change has come about because of forces. And obviously the development of the foot over time has meant that the great toe needs to have extra tissue supplying it to enable it to handle the forces that come through it during the biomechanics of walking. So we know the great toe is important to the foot, and we've said that it's connected to plantar fasciitis, but how? Well, if a person has reduction in movement in their great toe, they will have some gait problem on that side as they can't stretch the plantar fascia as far. As a result of that, there's less stored energy for the next part of the gait. And if we want to get technical, when the foot is lifted off the ground, the plantar fascia relaxes, so the arch of the foot flattens. If that makes sense, the foot's in the air, it's not doing anything. There's no forces acting on the foot. However, when the foot is lowered back to the ground, the great toe extends in doing so, and tension on the plantar fascia increases, causing this tightening and the lifting of the arch of the foot. This increased tension helps to raise up the arch of the foot, allowing the distribution of weight evenly across the foot, meaning that we've got increased stability, and these forces in the foot are going to be distributed so that they can propel us forward safely without actually damaging any of the other tissues or structures in the foot. And this tightening of the palmar fascia is that windlass mechanism we spoke about before. If the great toe's got limited extension, it can reduce the effectiveness of this windlass mechanism and increase the stress and tension on the palmar fascia. Hence, we're going to get more inflammation, more micro tears and things, which are going to form the pain that we associate with plantar fasciitis. Now, when it comes to diagnosing plantar fasciitis, given it's essentially derived from a problem with the windlass mechanism, it kind of makes sense that we've called the test for it the Windlass test. So for the Windlass test, we're going to ask the patient to stand on the edge of a step with their toes out in space. And we're going to dorsiflex the great toe at the metatarsophalangeal joint. In doing so, as that toe comes backwards, if we're getting pain at the medial side of the heel, specifically at the medial calcaneal tubercle, that kind of confirms our diagnosis, because guess where the majority of the force of the plantar fascia is going to go into? Yes, on the medial side of the calcaneus. And guess what's inserts there at the medial side of the calcaneus? Absolutely, the plantar fascia. So there you've got it. We're going to move the foot, we're going to cause pain at the heel, and we're going to confirm our diagnosis of plantar fasciitis. So we've managed to confirm that the patient has plantar fasciitis, but how do we want to treat it? Well, obviously, we need to look at the great toe, and over 60% of plantar fasciitis is related to overuse and strain issues that have come from there. However, the remaining 40% is from issues with regard to mobility, specifically linking to movement of the foot and the tightness of the Achilles tendon and calf muscles. So it makes sense that this reduction in the great toe will affect the fascia, but why would tight Achilles affect plantar fasciitis? You see, tight calf muscles contribute to the development of plantar fasciitis because the Achilles tendon, which connects the calf muscle into the heel, shares some of the load that the plantar fascia deals with during weight-bearing activities. A tight Achilles tendon will affect the windlass mechanism we spoke about previously because it limits the range of movement at the ankle joint, specifically in dorsiflexion, so lifting the foot up, meaning the biomechanics of the foot are going to change. This change is seen as the plantar fascia not being able to correctly raise the arch of the foot and subsequently placing additional load on the fascia, resulting in plantar fasciitis. So we know that reduction in movement in the great toe and the ankle will result in stress to the plantar fascia, but how does this actually become plantar fasciitis? Over time, this repeated excess stress on the tissue, on any tissue for that matter, but in this case the plantar fascia, will cause micro tears and inflammation. Ultimately, this is going to lead to the pain, and here's the crucial bit, the impaired function there. So we know what plantar fasciitis is, we know the potential causes of plantar fasciitis, but how do we treat it? Well, painkillers to start off with, and I know that seems almost an annoying thing to say, but people just won't engage as well with the physical therapy that they're required to do to help their plantar fasciitis without adequate analgesia, because physical therapy is often painful. So once we've encouraged them to use appropriate analgesia, then we can start by trying to stretch and strengthen the Achilles tendon and calf muscles. Note, I haven't said stretching the plantar fascia at this point. And by doing that, we're trying to improve the ankle flexibility and reduce the abnormal loading onto the plantar fascia. So the stretching exercises to loosen the calf muscles do reduce the strain on the plantar fascia and alleviate these symptoms. And that's why this stretching approach is going to be the core of the exercises that we're going to recommend. And often that's going to be done by having the patient push against the wall, pressing their affected heel down into the ground, so stretching the calf and the insertion into the heel at the same time. Over time, that will hopefully cause lengthening, and we're going to reduce the stress on the plantar fascia there. Similarly, as we spoke about with the Windlass test, where we're getting the patient to stand with their toes off the end of a step, we can turn the patient around and we can have them facing up the stairs, but with their heels off the back of the step. And we can carefully allow them to lower themselves down so their foot is dipped with their heel below the centre of their foot, putting, again, strain on their calves with gravity helping to move things down. It's a very good test because you get an excellent stretch there, but obviously it requires good mobility on the patient before they can do something like that. For example, we wouldn't want a patient who has an increased risk of fall doing something like that, a stretch like that. Conversely, some people will opt to try ice and compressing and trying to reduce inflammation on the palmar fascia via that route. It'll certainly provide an analgesic benefit, although how much improvement you're going to get with regard to the reducing the micro tears is unclear. Some patients can look to use foam rollers both on their calves and the palmar fascia. It's effective, but I can personally attest it is really quite unpleasant. The bottom line for me, though, there is, even once we've made that diagnosis of plantar fasciitis, I'm going to strongly recommend that patient goes and sees a physiotherapist so they can give them specific guidance to try and improve the problem and give them the most effective stretches for whatever it is that's caused their plantar fasciitis. Now, in the short term, whilst the patient is waiting to get access to the physio, we'll often advise the patient to wear proper shoes. I'm not quite sure what they mean by that. Does that mean no slippers, no Billy Connolly style banana shoes? I think in reality what they're meaning by that is supportive shoes, ideally so that those which have good arch support to reduce the strain on the fascia there. There is a middle option, however, between our stretchers and our supportive shoes, and that's going to be much more effective for patients who can't change their shoes. For example, they're using specific safety shoes at work, and that's getting supportive inner soles, both to try and correct any pronation or supination, which again might be affecting the gait, but also making sure that that insole has good arch support to compensate for any issues they may be with the shoe. So I hope this has been an effective overview on plantar fasciitis, explaining why we get these micro tears and strains and the pain from those in turn, but also things that we might be able to do to help reduce it. If this has been useful, please consider liking the video because it tells YouTube we're here, and subscribing to the channel because then you can engage us on the community tab and help us plan and decide which further videos we're going to do. With that in mind, take care, thank you for watching, and I'll see you in the next one. Cheerio.